would be really curious to hear about how your concept of public health has changed, if at all, since you started your program and for some finished it. And this time I'll kick it to Cindy to start off.
I think for me, I think I mentioned earlier that I was very aspirational when I came into my MPH program. I remember my personal statement. I wrote like, I want to be able to implement X, Y, and Z in Myanmar, which is where my parents are from. And it was just not fully fleshed out. Obviously, it was just an idea that I thought was going to be aligned to like my mental health interests and being able to destigmatize mental health, especially in these populations. But while I'm still very interested in, being culturally sensitive and still developing like some sort of intervention and like developing more sensitive psychometric tools, there is still a lack of Asian representation in research and also funding for this research from conversations that I've had with Asian researchers at Harvard. So I think this definitely is where I've shifted to more like research focused, really wanting to contribute more to this field so that there is an increase of funding. I just feel like if there's more researchers wanting to do research in this field, ultimately more funding. Obviously, it won't be that simple, but over time, hopefully there will be more funding. And I think I now see like public health is very multi-level. It's just a complex networks of problems, behaviors, and stakeholders that all need to be engaged cohesively to just bring that effective and sustainable change that I wanted before, like when I wanted to start my MPH program, because I was just so focused at one level. And while that will help maybe like a group of people in a certain community, I want to be able to make a larger scale change, at least for populations and countries and just, people within my culture. So that's all me.
And Ruhi, would you like to go next?
Yeah, I think coming into school, I was really focused on social determinants of health and how they affect public health. Was my notion of public health was like all these social determinants of health. That's how I would explain it when I often get questions from family and relatives like, okay, what is public health? What do you even do? And I think coming out of the program, what I have understood is a lot more about the power dynamics in public health and the power distribution, and that the work really has to be focused more on this distribution of power, this disproportionate, unequal distribution of power among the people who hold it and the communities who are disproportionately affected by those policies that we're trying to enact, the interventions that we're trying to make, and who don't have a voice in the matter, who are not being represented at the level that we're designing these policies, who are not, actually we're being, having a voice at the table in their own communities, the policies that are affecting them, the interventions that are affecting them. And the course that was really transformative in my HSPH experience was called Race, Poverty, and Power. And it was just incredible to think about, one, the fact that it was an elective course. And if I hadn't taken it, I would have been, I can't even think about it. But this professor, Professor Mac Demitash, she is just incredible. And she herself is a Romani activist. And I learned so much from that course, not only about myself, but about in the small cohort of students, we learned so much from each other. And I think it was just such an excellent reflection of what, even virtually, what, a case-based community, what, learning at a grad school level should look like, what, really interrogating the work and questioning each other, questioning different narratives, really diving into these important questions in public health should look like. And I really wish that more of my classes at HSPH had looked like that, but it definitely made me think more about this deeper level of every time we are considering an intervention or considering implementing something, who is at the table, who is writing this policy or designing this, and who is it affecting, and are they the same people? And I think keeping that in mind at all times is a lot more around what my notion of public health is now than it was coming in, of just kind of the general concepts of social determinants of health, and these are the things that affect our physical health. I think it's a lot more nuanced than that now.
And Ellen, do you have anything you'd like to add?
I think I would say maybe I don't know how much my understanding of what public health is has changed a ton since coming to school. Maybe that's in part because this whole year's been virtual. So I've been, it's maybe been a bit of confirmation bias of going to seminars that, kind of already just flesh out things that I am already kind of aware of. But I guess really the COVID year, I think more than necessarily starting grad school, has just reinforced in my mind how much public health is a manifestation of, I mean, so many, if not, like, one could even make an argument for like all of kind of the historical and current like issues in our society, right? Like just everything, environmental, economic, systemic racism, like just everything bundled into one, right? Just that it in some ways is like, it's when the rubber hits the road with like, why do people actually care about economic inequality? Why do people care about these things? It's like, it's when it starts impacting us and our kids, right? Like, and I think, yeah, the combination of being at the school and, listening to more people talk about these issues, and then also just kind of seeing COVID play out, cemented that for me. And then the other thing that I think, combination of being at the school and kind of observing the pandemic past year plus, has just shown me the extent to which public health, not necessarily public health research, but public health in practice is about education. And I think I didn't, in undergrad fully appreciate, I think, the extent to which education, both kind of, maybe more in community-based work, like mutual education, community members educating, public health practitioners and policymakers, and vice versa, trying to kind of people who are more familiar with the, more technical or current research being done, translating that, kind of picking out the most important pieces, right, to be able to communicate those to policymakers, to community members, and just that, especially kind of from my field, there's so much data, right? Like there's so many interesting research questions to be asking, but figuring out like what are the most important pieces that actually can't wait, right? Like trying to prioritize, and this is prioritizing information, prioritizing causes, given kind of the limited funding that was already mentioned earlier. I think, yeah, just my understanding, it's not a concise definition, but my understanding of public health as this kind of continuing to educate ourselves and educate others, and like, distilling information for the public good is kind of been brought out to me more this year than any other.